Greetings and welcome to the poster presentation for Partnering in Palliative Care. I am Justin Porter. I'm a paramedic and an RN, and I'm joined by Dr. Raleigh Bowden. So, our project is focused on creating a palliative care service in a rural county in Washington State. Now, this is a very wicked problem, and I'll tell you some of the reasons why it is. You can see down in the left-hand corner of your screen, you see 3 stoplights, an addition sign, a flag, which is the flag of Connecticut, and then equals us. That's a picture of our county in the spring or summer. The reason that is so is because we are a landmass the size of Connecticut, yet we only have 3 stoplights. So you can imagine how rural and large our county is. Our population is also disproportionately elderly, chronically ill, and impoverished. Our poverty rate is twice that of the rest of Washington State. So it makes it a really hard situation just at a baseline. You can imagine that our healthcare system, because it's such a rural area, is really fragmented, and the distance to get to healthcare services can be really spread out. So a patient might have to drive an hour plus to get to a hospital. We also have a lack of trained providers, and that's really hard when you're trying to introduce a specialty care. So enter us, palliative care. What is palliative care? Most people don't know what it is, lay people and healthcare providers alike. Palliative care is a specialized care that aims to relieve the stress and symptoms of serious illness. The focus is on improving quality of life for the patient and their families. Now I'll turn it over to Raleigh.
I'm going to talk about our clinical activities. We have 5 areas that we're working on. The first is that we're piloting now a clinical service that delivers palliative care services where the patients are at, in their homes, by Zoom, in the clinic, in the hospital. We're starting this pilot with 4 partners, a hospital, a home health agency, and 2 clinic systems. We're also collecting data, and thus far we've been able to show that both patients and caregivers and the providers referring patients to us are experiencing high satisfaction. Our second goal is financial sustainability. We're really excited that we've been able to secure a couple of additional grants to fund our work, and we're working on reimbursement strategies to include billing, where we hope we'll be able to recoup approximately 50% of the cost of our program. Our third area is provider training. We're fortunate that 2 of the members of our team are taking a palliative care certificate program at the University of Washington that they'll complete this year, and we're also developing a palliative care skills training program for emergency medical personnel across the county. Our goal is to provide advanced care planning for our patients across Okanogan County, and to do that, we're recruiting volunteer facilitators, which will help make this part of the program independent from our leadership group. Finally, we're working on piloting culturally sensitive advanced care planning tools to be respectful of the Hispanic and Native communities that we serve. Our final area of focus is on community engagement. We've been successful in publishing a couple of opinion pieces in the newspaper. We're creating some really short and often funny educational videos, both for providers and for patients. And we're collaborating with local tribal health services to get a better insight into the services that those patients might need. We have 3 next steps. The first is to work closely with our largest partner, who will provide us an administrative home that will make it easier to bill and use a common electronic medical record. The second is to continue to develop primary palliative care skills amongst primary care providers to support the work that we can do as a specialty service. And then finally, we'll continue to work on our goals for financial sustainability.